Hello, good morning, and very good welcome from the African Union headquarters, where we bring you our usual press briefing coming from the Africa CDC. And as usual, Dr. John Nkengasong, the director of the Africa CDC, is here with us. And today he'll be giving us regular updates on the COVID-19 situation and the Africa CDC continental response activities across the 55 member states of the African Union. He will also be touching on the status of vaccine acquisition to begin immunization across the continent in the coming months. He will also be talking about the need to encourage African citizens to continue the wearing of masks, the observing of other public health measures as the second wave of COVID-19 infections are increasing on our continent. And then obviously after that, we will follow with our usual Q&A session. And today you can join us in two of the official languages of the African Union, and we are coming to you in French and English. And you can obviously access your preferred language as usual by clicking the globe icon at the bottom of the Zoom screen. This press briefing is also coming to you on the African Union platforms, and those include Facebook, YouTube, and the AU live stream channel. When we do get to the Q&A session, please feel free to use the WhatsApp number +251 94 5502 310. Let me come back again with that one. +251 94 5502 310. Alternatively, you can join us live on this platform, or you can send in your question through the Q&A section. All right, let me now invite Dr. John Nkengasong, the Africa CDC Director, to give us his briefing for today. Good morning, Dr. John, and you have the floor.
Good morning, Wayne. Greetings, colleagues and journalists, the media. It's always a pleasure to be with you during these weekly briefings. And I will do this exactly what Wayne indicated. I would first of all start with the epidemiological update, and then we discuss some of the support activities that Africa CDC and the African Union Commission continues to provide to the continent to respond, and then conclude with remarks on the vaccines efforts across the continent. As of 9 a.m. East African time today, close to 95 million cases of COVID-19 infections have been recorded in the world, of which about 2 million deaths have occurred, unfortunately. That leads to a case fatality rate of 2.2%. On the continent of Africa, 3.3 million cases have been recorded, which accounts for 3.5% of the total cases reported globally. Of that number, 2.7 million have recovered, which represents 83% overall of the recovery. Unfortunately, we have recorded 81,000 deaths across the continent with a case fatality rate of 2.5% and accounting for 4% of deaths reported globally. On this note, I would like to comment on the numbers you just heard. Previously, when the global case fatality rate used to be 2.4%, the continental case fatality rate was around 2.2%. But now you realize that the numbers have reversed. And whereas the global case fatality rate is now 2.2%, the continental case fatality rate is 2.5%. So definitely we are seeing a higher number of deaths occurring on the continent. And I'll come back to that shortly. 5 countries are accounting for about 70% of all cases reported in Africa, including South Africa, with 41%, that is 1.3 million cases. Morocco, 14%, representing 460,000 cases. Tunisia, 6%, representing 188,000 cases. Egypt, 5%, 158,000 cases, and Ethiopia 4% with 130,000 cases. As I indicated earlier, I would like to really focus on the case fatality rate because it is beginning to be worrying and concerning for all of us. The number of countries with case fatality rate higher than the global number, which is, as I said earlier, is 2.2%, continue to increase. 2 additional countries were added to this week's list for a total of 21 countries. That is 38% of countries now in Africa are reporting case fatality rates of more than the global total. And the long list of them are present here. I will not go through all of them, but maybe just cite a few of them that are really above 3%. And I'll just draw a cutoff line there with Sahrawi Republic with 11.8%, Sudan 6.2%, Egypt 5.5%, Liberia 4.4%, Mali 4%, Chad 3.8%, Niger 3.5%, Gambia 3.3%, Tunisia 3.1%, Swatini 3.1%, and the DR Congo 3.0%, and Zimbabwe 3.0%. Those are just numbers above the 3 cutoff point. In terms of the epidemiological trends, during the week 2 of this year, that is the week ranging between 11 and 17 of January, 207,000 new cases have been recorded, with 6,100 new deaths reported. This represents a slight decrease of about 7% compared to last week, but a 10% increase in deaths over the previous week, which we are calling the week 1 of 2021. The highest proportion of new cases reported for the week was from Southern Africa, 66%, followed by North Africa, 19%, West Africa, 9%, East Africa, 4%, and Central Africa, 2%. 5 countries are reporting the highest number of new cases, including South Africa with 100,000 new cases, Tunisia 19,000, Nigeria 11,000, Zambia 9,000, and Morocco 7,000. If you now look at the 4 weeks trends over the epidemiologic week between December 22 and January 17. And this is important because we are tracking the changes in the occurrence of new cases, especially during the festivity period and after the festivity period. We notice that an overall increase of 14% has been recorded, that is of new cases. And on average, by region, we have 25% increase over the last 4 weeks in Central Africa, a 10% decrease. Again, I emphasize decrease in East Africa, 1% increase in Northern Africa, 22% increase in Southern Africa, and similarly, that is 22% increase in West Africa. Again, over the same time period, if we look at some of our most populous countries, Nigeria has recorded a 23% increase in new cases over the 4-week period. Ethiopia, 2% decrease over that same period. Egypt, 20% increase. DRC, 13% increase. And South Africa, 17% increase. Kenya continues to record a downward trend with 14% average decrease over the last 4 weeks. So that is some good news there in Kenya. Now, with respect to deaths, Nigeria over the last 4 weeks has recorded 49% average increase in number of deaths. Ethiopia, 4% average decrease. Egypt, 28% average increase. DRC, 2% average decrease. South Africa, 30% average increase. And Kenya, 11% average decrease. In terms of testing, as a continent, we are now tested close to 30 million tests. To be very specific, 29.3 million tests. And we continue to now adjust our community of practice, support, and training to accommodate training on vaccines, on access to vaccines and distribution on the continent. So such trainings have already started. We also are conducting trainings and supporting member states to conduct mortality surveillance across member states so that we know exactly how many people are dying and count them accurately to the best we can. Some good news here. We just this week received supplies, that is response supplies to COVID, excuse me, through UNICEF, worth $24 million that we have procured. And the supplies include 4 million masks, 2 million surgical gowns, 200,000 face shields, 2.5 million gloves, 700 oxygen concentrators, oxygen delivery equipment, 1 million COVID tests, and other clinical lab supplies. And these are all materials that we will be distributing to member states to support them to fight the second wave of the pandemic. We continue to be very grateful to our partners, and more recently, the Rockefeller Foundation has joined the fight against COVID with us, and with a contribution of $12 million to expand the coverage of testing and strengthen our ability to respond. Lastly, let me just conclude on the vaccine piece. So following the announcement of the 270 million doses of vaccines that was made last week by President Ramaphosa, I'm pleased to announce that the pre-order process has started with member states. I think several member states, I can't give you the exact number because they keep changing, are now engaged with a platform that is the African Medical Supply Platform to place their orders. And as I indicated earlier, we've started training to engage with community, with healthcare workers so that they can actually understand how to administer the vaccines. There are a couple of things that I would like to conclude with. That it's very clear that the narrative that vaccines require ultra chains and we don't have them on the continent is, in my view, not accurate. Of the vaccines that we know that are out there, 2 of them, that is the Moderna vaccine, which, by the way, is restricted to the United States and requires a minus 20 degrees Celsius. The Pfizer vaccine requires a minus 70 degrees Celsius. So if one was to make available the Pfizer vaccine to me and said, administer it in Ethiopia, what will I do? I mean, I'll do the simple things. But one, all we need to do is to get the vaccines to the port, the airport in Addis Ababa. And Ethiopian Airlines, Kenya Airlines, and others are now equipped to transport vaccines at ultra cold chain requirement. Then from there, the second thing you do is to create a vaccination coordinating unit at the Ethiopian Public Health Institute, where they already have cold chains there. They have series of -70s there. They can and liquid nitrogen tanks. So that shouldn't be a problem. So there, I take my vaccines from the airport, store them at the EPHI, the Ethiopian Public Health Institute. The third thing we need to do now will be to create vaccination points across Addis Ababa, which means you put in 1 or 2 deep freezers across these vaccination points, say about 10 of them, around 10 hospitals or clinics in Addis Ababa. And each of that, the -70 will cost you about $15,000. So that is very, very doable. The fourth thing we'll do is to train healthcare workers around them. So you train about 20 healthcare workers, people that take records, secretaries that track things, put in a good information system, paper-based or electronic, and then train people how to provide the injection with the supplies. That is the needles, the cotton, and the swab there. Have a record of who comes in to get the vaccine, and lastly, I'll mobilize the community and talk to the community and improve community literacy on vaccines and vaccination. If you do those 5 things, you are ready to use even the most complex vaccine and start immunizing a city like Addis Ababa, where over 60% of the infections are in Ethiopia. So if we do that, then you begin to break the backbone of the infection across a country of 100 and so million by starting up in Addis Ababa. So I just wanted to go through this process very carefully so that we have a common understanding of what it is. So if I do that, it will take me about 2 months or so to achieve 60% of my immunization in a city of 5 million like Addis Ababa. By the time we finish doing that, new versions of vaccines will arrive where it will require less stringent conditions like the AstraZeneca vaccine, and then we can roll it out to other parts of the country. So I just wanted to be very clear that we at the Africa CDC believe that we are ready to roll this out. We just need the appropriate delivery of the vaccines. Countries must do what they have to do. We have developed guidelines, Africa CDC, to guide countries on to do exactly what I just explained. We are working very closely with the World Health Organization to be sure that we align and coordinate our efforts as much as possible. So I think on that, I will also like to say that to conclude that one of our major priorities now, given the alarming rate of infections going on across the continent, especially the death rates, we need to protect our healthcare workers as much as possible. So our greatest priority now is to make sure that we access enough doses of vaccines to cover our healthcare workers so that we can protect that frontline work. So that is as a subset of the initiative of the 270 million doses there. I think we'll be really looking at how much can we acquire quickly so that in the coming weeks, we should be able to start that vaccination exercise for our healthcare workers. As a continent, we have about 3 million healthcare workers across the continent. And if we strive to vaccinate all of them as soon as possible, it would really protect them. And not just protect them against COVID, but also protect our health system, because that is our greatest concern, is that healthcare workers will be infected, many will die, and then we also have a burden of HIV disease, TB, malaria, and other diseases out there that will be neglected and will further compound the problem. So that specific intervention is a top priority for all of us. Thank you, Wynne.
Thank you very much, John, for that briefing. And we move straight into the questions. The first one is coming from Coletta Wanjohi, and she's with FSN. Coletta says, the issue of equitable distribution continues to raise concern, with the WHO reiterating recently on the need for developed countries to be fair to developing countries. Do you think that there is any hope in us actually enjoying equitable distribution of the vaccines in the near future?
I remain optimistic that all our efforts collectively, that is, the developed world and the developing countries, will lead us to the right direction. And the right direction meaning equitable access. We have said this many times, and that it will be a terrible mistake that there's the gap that because of COVID vaccine, it further exacerbates the gaps, the inequities that exist between the developed countries and developing countries in terms of access to care. I think no one wants to see that. No one wants to see tensions between the developed world and the developing countries established because of a lack of equitable and timely access to vaccines. No one wants to see distrust established between the developed world and the developing countries because of lack of access to vaccines or equitable access to vaccines. I think I remain very hopeful that we will come to a common place. I think we are making some very positive steps, and our leadership, the leadership of the continent, through the office of President Cyril Ramaphosa as the chair of the African Union, through His Excellency Moussa Faki as the chair of the African Union Commission, are all working day and night to make sure that we get timely access and equitable access to vaccines in the country.
Thank you very much. The next question is coming from our WhatsApp platform, and this one is coming from Saki Leguyo. And she says, can you explain a little bit more about the announcement made yesterday on the pre-ordering of the COVID-19 vaccines on the African Medical Supplies platform? What are member states expected to do, and what would be the role of the media in this?
So it's a very good question. I mean, what we have done is issue a note verbal, which is a formal communication from the African Union to all member states, explaining the process and then attaching the forms, the right forms that countries will need to fill to make in their requests. I think that is extremely important. The process is not, we've done this exercise before when we established the platform early last year, where to support diagnostics and other personal protective equipment, countries are used to, they have their access code and they have the projected number of their own allocations on the platform. So I think they are used to using the platform. It's the same formula as we use for the PPEs and diagnostics there. So that much is covered. With respect to the media, the key question is really, or the key area of need for your support is continue to engage the countries and let them place their orders, because it is based on those orders that we'll be able to arrange for the deliveries and the financial arrangements there. So again, that is a role for the media. The media also has an important role to continue to work with us, as you've done over the last close to 1 year, to make sure that the public understands that these vaccines are safe, they are efficacious. As I indicated the other week before the holidays, that we conducted a perception survey across 15 countries in Africa, covering 15,000 participants, and the acceptance rate ranged from about 60% to 90%. So again, that is an area of collaboration and cooperation between us, the media, us in public health and the media, to continue to make sure that we get to as highest level possible for acceptance of the vaccines as they begin to get to the country. So if there are other areas of partnership and cooperation with the media, please let us know. We'll be happy to explore this. This is a pandemic that will require all facets of our community, what I call the whole of society approach to fight and win the battle against this pandemic.
From Cara Anna from Associated Press. Thank you for the briefing. Are member states telling you that they cannot afford ultra cold freezers, and what outside money is
Hello. Can James step in?